This was one. Oftentimes I'm suspecting that a patient's symptoms are no longer from the concussion. However, I find it difficult to have that discussion because the concussion gives them something to, quote, blame for their symptoms. Any suggestions on how to have this conversation? And I think any one of the three of you could answer. Donna, would you be able to answer that?
Well, I could try. You notice that all three of us were nodding our heads. So that is certainly a challenge that occurs. And what I try to do is really, really sit with the patient and say, try to understand what it is that is not working for them. And often there's something else in their life that they are unhappy about or that is causing them suffering. And they're putting it onto the concussion because it's easier to put it on the concussion than to deal with some of the very, very difficult life circumstances they may have. And sometimes this is quite a process. And for those of you, not trained in psychotherapy, it may be just trying to introduce that and to encourage them to pick something that they're going to work on to start to move forward, because it can feel overwhelming if they're blaming or attributing, I shouldn't say blame, attributing so many things to the concussion. And so, to really try to say, what is the number one symptom that is, get back to the symptoms. What is the number one symptom causing you the most probable? Let's just focus on that and work on moving you forward with that symptom. But it often requires multiple sessions and potentially some psychotherapeutic intervention. But for any specialty, what is the number one symptom causing you the most suffering, that is most holding you back right now? And let's see if we can make that symptom a little bit better. Again, trying to instill hope that they can make progress and that they can move forward. And Jamie and Stan may have some other thoughts on that.
Let me talk about how I can convince my patient to accept this. And Donna and Jamie are right there. When the patients have this, the integral parts to get them to agree to treatment. So the first thing I do is I validate their suffering. I say, I understand you're suffering. I understand you're miserable. And in no way are you making up your symptoms. You're not crazy, all the things they've been told. And I say, using the chronic pain model, I say, what, in times of chronic pain, the way that your brain interprets signals from your body has been altered. And treating this with traditional measures doesn't work. It's like giving someone the wrong antibiotic. So what you're doing is not working. It doesn't diminish your suffering. I believe you, but we need to look at this differently. And I can't do that by myself. That's the way I set it up.
And something I might add is that, sometimes if I've known them, I can say, here are some things that I believe are getting in the way of your recovery or, moving your recovery along. And then I provide examples of what I think that is and then how I think that we can work on it. So I think a while back I noticed one of the questions about, how do you bring up the good old days bias thing? You use it all the time. And I talk about that study and I say, when we've talked so far, you said, I've never had a memory problem. I've never had a headache. Like, that's just so unusual for that to happen. And when you look at studies of people who are suffering and who are injured and they reflect back on their life before, there is this kind of wistfulness about how things used to be. And we all do that when we fall on hard times for a variety of reasons. And so, part of this may be kind of looking backwards instead of looking forward. So rather than talking about, who I was 5 years ago, let's talk about how we're going to move forward in the next 3 months, or how are you going to move forward in the next 4 weeks. So I kind of introduce it like that as well.